Welcome to Oncology Data Advisor. Today we're here at ONS Congress and I'm joined by Janie Metsker. Thank you so much for coming on today.
Thank you for having me.
It's great to finally meet you in person. I know we've done a couple of virtual interviews before, but this is great.
That's great. Yeah, nice to meet you as well and your team.
Yes. Would you like to start off by introducing yourself and saying what you do?
Yeah. So I'm Janie Metsker. I'm the clinical coordinator at St. Luke's Koontz Center for Advanced Breast Cancer in Kansas City. And so I navigate patients involved in all aspects of care. I also organize and coordinate our metastatic breast cancer retreats that we do annually. We do one for couples and then we do one for singles with a support person. So that's a big passion of mine actually. And so that's my
Great.
role.
So you presented a poster here titled Updates on the Management of Hyperglycemia and Rash Associated with PI3K Inhibitors. So
Yes.
Going back to a bit of background, what makes these two adverse events so challenging to manage?
Well, I think the thing that makes them challenging is that they are prevalent and they can be difficult to manage, and I guess ultimately for the patient difficult to live with. They can also be, somewhat dangerous, but we also need to, manage those, the side effects to help the patient to stay on treatment. I think the most important part of it is that the management of these side effects, and they are manageable. I think the thing that's a real key with alpelisib and what we presented today was that they are manageable and they are treatable side effects and they're reversible. And to keep patients on treatment is really the goal, so that a patient doesn't have to stop treatment just because they're having these adverse events. The side effects are causing them to stop treatment.
Right. So what were the updates that you found and how these are managed?
Well, some of the updates included some of the escalation of, the antihistamines that are used for treating rash, and then also in the hyperglycemia aspect of it, there's some really new data that's out from the phase 2 of the Metallica trial that is showing that really prophylactic metformin use in especially those patients that are kind of in that what we would consider maybe pre-diabetic, where their hemoglobin A1C is between 5.7 and 6.4. Maybe they have one or more of the risk factors of being 70 or older, obesity, so all some of those types of things that are the risk factors for hyperglycemia. That metformin can really be a prophylactic use of that can be very important.
Great. So for nurses who aren't in attendance this year, is there any important info about this that they could take home and start to use in their practices?
Yeah, I think the take home to me is with this as these novel therapies that have been developed for metastatic breast cancer that we've seen come out in the last 7 to 8 years and so forth, is that first of all, especially alpelisib and others as well, is patient education. Really for nurses to be involved in patient education, giving the patients the information they need, what to expect, when to expect it, when they need to call and report those side effects, I think is very important. So that's the first thing, is patient education. And I think the second thing is prevention and the prophylactic treatment. So that when our poster today was on hyperglycemia and rash, and one of the things is to start that non-sedating antihistamine to prevent rash in all patients. And then, like I've said, some of the things to be preventative with hyperglycemia, really in all patients, suggesting and getting them to understand or start a low, carbohydrate diet, even maybe a ketogenic diet if they go so far. And so that prophylactic, and then really try to be preventative and then intervene much sooner. And maybe the third thing would be for nurses to understand how to assess when the patient calls over the phone, because a lot of time this is going to be a phone call from the patient about what their blood sugar was that morning, or their, the rash, the rash that came up overnight. For them to understand how to evaluate that and what's important in getting, the information to get from the patient, and then using that grading scale, as we all know, grade 1, 2, 3, 4, to really get an accurate, assessment, to talk with their providers to get those interventions in a timely fashion.
Awesome. Great. So, how are you enjoying your time at ONS Congress this
Oh,
year?
it's great. It's been a lot of fun, a lot of energy here. Had a lot of fun with some friends and seeing them, catching up with other nurses, and 3,000 nurses. What can go wrong, right?
Yes. Awesome. Well, it was great meeting you, and thank you so much for stopping by today.
Oh, you're welcome. Thanks for having me.
Awesome.